Hello everyone. Today we are going to discuss about supportive psychotherapy. Hope you all know the meaning of supportive. Supportive means provide encouragement and emotional help. We will see how we can give this encouragement and emotional support through supportive psychotherapy. Supportive psychotherapy is a kind of therapy is used to restore or improve self-esteem and skills. In the therapy session, the therapist will check two things such as examination of relationship between the therapist and the client and examination of patterns of emotional response of the patient. This therapy is completely dependent upon therapeutic relationship or therapeutic alliance. So what is therapeutic relationship? The therapeutic relationship is the relationship between the client and the nurse, or it is the relationship between the client and healthcare team. Supportive therapy will help to alleviate the symptoms, to improve self-esteem, to restore relation to the reality, to regulate impulses, to avoid negative thinking of the patient, and also to reinforce the ability to cope up with life stressors and challenges. So this therapy is helping to alleviate the symptoms, to improve the self-esteem of the patient, and also to reinforce the ability to cope up with the life stressors, life problems, and challenges. While coming to the aim, we can see this therapy will help to preserve and enhance the client's voice, authority, and agency. Supportive psychotherapy helps the client to sort out their problems through comforting, advising, encouraging, reassuring, and listening. So the therapists are doing some process like comforting the patient, advising the patient, encouraging the patient, reassuring the patient, and listening the patient to sort out their problems. So we can say this supportive therapy is providing a comfortable atmosphere to the patient or a comfortable environment to the patient to exhale or to tell all the emotional difficulties out. The therapist may inform the patient about their illness and about how to manage it and how to adjust to it. That's an important point we can see in supportive psychotherapy. And another thing is to provide maximum care to the patient, the therapist will discuss about the patient to others. Others in the sense family, relatives, neighbors, friends, etc. Why means it helps to understand what others are feeling towards the patient. It is very important to provide maximum care to the patient. The therapist also usually encourage the client or the patient to improve the social interaction of the patient. He may encourage the client to participate in any recreational activities also to improve the relaxation of the patient. Sometimes therapists will act like guide or a teacher or a parent during the time of therapy. The physician takes on many parental roles including comforting, soothing, encouraging and limit setting to encourage the client. This role will help the client to encourage growth, autonomy and self-sufficiency. Now we will see the indications of supportive psychotherapy or in which are all the conditions we can use this therapy. We can use this therapy in anxiety, depression, relationship issues, personality disorders, thinking problems, behavioral problems and emotional disturbances. What is the difference of this therapy from other therapy? Supportive psychotherapy addresses only problems and conflicts that the patient is aware of. That is the important difference of this therapy from other therapy. The therapist will focus on the patient's conscious mind and what he is aware of. Normally, other therapies will dig into the past also. What is the traumatic experience they have faced during their past lifetime? But this therapy only will focus on the patient conscious mind and what he is aware of. Supportive psychotherapy looks at abstract entities such as defense mechanism only when they seem adaptive or maladaptive. Finally, the therapist will give advice, He speaks openly and he may describe his own feelings towards the patient. Now we will see the techniques of supportive psychotherapy. First technique is praise. Praise means express warm approval. Praise is a good supportive technique and praise may reinforce positive changes in behavior, but we must give accurate and sincere praising. For that, the therapist can ask the feedback from the patient like, what do you think? I will give you an example. The patient is telling like, I took my tablet every day last week. Then to praise the patient, what we supposed to tell or what we supposed to explain means good job. And I really appreciate you. You said you were going to do this without skipping any time and you did it. You did a good job. What do you think? So in that way, if we praise the patient, definitely they get some confidence and they get some relaxation. Next technique is reassurance. Reassurance means the action of removing someone's doubts or fears. Reassurance is a useful and common technique in all therapies, but it must be accurate and honest as like praise. The physician must limit reassurance to areas in which she or he has expert knowledge or dependable information. Reassurance based on patient history and reinforcement of adaptive behavior. One example I will give you, the patient is asking like, if this is cancer, will I be able to have another baby? Will I die from it? Then what the patient's physician supposed to tell means, it's like during your first pregnancy, we worked together and checked everything out. This is the same thing and we don't have an exact answer now, but we will work together maximum and we will continue treatments and everything is fine or everything is going to fine. So in that way we have to reassure the patient. Next technique is encouragement. Encouragement means the action of giving someone supports, confidence or hope. Encouragement is depend upon the condition of the patient or it is depend upon the preference of the patient. If the patient is affected with depression, the therapist will encourage the patient to maintain self-esteem and to interact with others. So depend upon the condition and depend upon the preference, encouragement will get different. To encourage the patient, the physician will cut short big tasks into small sessions and with their small effort, gradually a big task will complete and they feel very happy and relaxed. I will give you an example. When we meet next day, I'll be really interested to see and discuss the specific small step you took to control your anger in difficult situation. So, if you tell like that, definitely the patient will take some steps to control the anger. If you directly tell in a scolding way or scolding manner with anger, if you tell this, definitely they cannot change their behavior. But in a tactic way, in an encouragement way, if you tell, when we meet next time, I'll be really interested or excited to see and discuss the specific small steps you took to control your anger in difficult situation. Like that, if you tell, definitely they feel some encouragement, they feel some confidence, and definitely they will try to change the behavior. Next technique is reframing. Reframing involves looking at same thing in a different angle and in a new way of looking at things. Example, I can see how you are disappointed because you couldn't participate in athletics due to that strain. I can also see how you might use this semester to focus on your academic instead athletics. So here we are reframing the angle of the patient or reframing the angle of the thing in a separate manner. Like I patient is telling, I can see how you're disappointed. To sort out that disappointment and another conversation will do, I can also see how you might use the semester to focus on your academic instead athletics. So reframing involves looking at something in a different angle and new way of looking at things. It helps to give some relaxation and it also gives some confidence to the patient to go ahead. Next technique is advice and teaching. Advice is an important tactic for the physician to use in supportive psychotherapy. Advice and teaching are most appropriate in areas where the physician is professionally expert. An example I will give you, physician is telling like, this is the third time I've seen you for bronchitis in 2 months, and effect that cigarette on your lung is too much. I think this is the time to join in a smoking cessation program. In that conversation, there are chances of asking a question, what is bronchitis? There are chances of asking this question. Bronchitis means you have to explain what is bronchitis. So the physician must need thorough knowledge regarding bronchitis. So advice and teaching are more appropriate in areas where the physician is professionally expert. Teaching is more important than advice. Therapists must give confident teaching session in simple language and based on the level of understanding of the client. First, we have to understand the level of understanding, in which way they can understand, whether they are educated, not educated, whether they have a standard, whether they cannot able to understand medical term or they can able to understand medical term. So after understanding all these things, we have to teach the client in a simple language. Next thing is language. Language is another technique which we can use in supportive psychotherapy to do the magics. Through language, we can attack the person, at the same time we can praise the person. I will give you an example. Like why? Why you didn't go? These phrases are often experienced as attacks, right? Why? Why you are not doing? Why you did this? Why you didn't do? Like attacking words. Instead of that, you can ask like, can you, could you, shall I, like phrases that increases the confidence and positive relationship between the client and therapist. It is better to ask general open-ended question than the closed-ended question whenever possible, because the open-ended questions will give more opportunity and chance to talk more. If the closed-ended question means the answer will complete in yes or no. Now we will see the effectiveness of supportive psychotherapy. Supportive psychotherapy is very effective in 99% of the people. Studies have shown that supportive psychotherapy is effective in treating a variety of emotional challenges and mental health problems. Therapeutic alliance or therapeutic relationship is a good predictor of successful psychotherapy. Therefore, psychotherapy such as supportive psychotherapy is designed to promote this alliance or this relationship. Supportive psychotherapy is great for clients who are new to therapy because it provides less structured therapeutic environment. That is an important point in supportive psychotherapy. It can give, and it is great for clients who are new to therapy as it provides a less structured therapeutic environment. Now we will see the time and sessions of therapy. There won't be any time limiting and there won't be a particular session for this therapy. Supportive psychotherapy is not following any structural pattern, so time and sessions of the therapy is completely depend upon the interaction between the client and therapist. But the therapy's time and session is depend upon some factors such as bond or the interaction or the relation between the client and therapist, agreement on tasks and goals of the therapy, client's capacity to perform the therapeutic work, and the therapist's empathetic relatedness and involvement. So based on these factors, time and the session of the therapy is varied. Now we will see a technique which we are using in supportive psychotherapy, that is behavioral rehearsal. It helps the person to learn new behaviors. A therapist will teach and ask the client to act out situation in which new behaviors are practiced. So in behavioral rehearsal, we are rehearsing or practicing some behavior. Here a person can rehearse and practice behaviors and response in order to be ready to use them in real life. Behavioral rehearsal is a way to improve social skills and interactions with other people. I will give you an example. A person could simply imagine themselves in a meeting of many members and imagine themselves performing behaviors and responding appropriately, like wishing, greeting, body postures, gestures, the way of talking, way of responding back, everything they can rehearse before starting the conversation. Other method includes role playing or talking about future behaviors and response with another person in the sense therapist. Who can provide this supportive psychotherapy? A mental health counselor, social worker, psychologist and psychiatrist can provide this therapy to the patient. But regardless of their degree and qualification. They must possess or they should possess empathy, a non directive approach, and knowledge of other types of therapy. So this is about supportive psychotherapy. So this therapy is providing encouragement and emotional support. Also, it helps to improve the social skills and self-esteem of the patient.